Hi, this is Abdul Karim from Khaleej Times, and in this video we're looking at the terms pandemic, epidemic and an outbreak when referring to the coronavirus. Now globally, the cases of the COVID-19 as of today have crossed over 80,000 and the death toll is closer to 3,000. The outbreak that originated in Wuhan, China, has now reached more than 25 countries and has spread in parts of Asia, Europe and the Middle East in recent days. Experts have declared the outbreak as a health emergency of international concern. But the question raised is if the outbreak has the potential to develop into a pandemic. Now, the reason why we are discussing the idea of a pandemic is because in a recent press briefing, the World Health Organization said that this virus absolutely has pandemic potential.
Does this virus have pandemic potential? Absolutely, it has.
Now let's discuss what a pandemic is. Pandemic is a term used for an infectious disease threatening lots of people all over the world simultaneously in excess. A disease or condition is not a pandemic merely because it is widespread or kills many people. It must also be infectious. Pandemics are more likely if a virus is brand new, when it is able to infect people easily and can spread from person to person in an efficient way. Furthermore, viruses that have caused past pandemics typically originated from animal influenza viruses. An example of a pandemic would be the H1N1 flu pandemic in 2009, which killed hundreds of thousands of people worldwide. Meanwhile, an epidemic is a large outbreak, one that spreads within a population or region. The commonly used word outbreak carries the same definition, but is often used for a more limited geographical area. One of the most famous epidemics was the Ebola virus epidemic of 2013 that claimed the lives of over 11,000 people. While the Ebola epidemic was mainly confined to Western African countries, it was never classified as a pandemic. Despite the global reach of the disease, the World Health Organization has so far declined to declare COVID-19 a pandemic. Although the COVID-19 virus has been classified as an epidemic because of the majority of cases being reported in China, with a few hundred cases globally, officials say it is only a few steps away from being a pandemic. The World Health Organization also said that it was too early to call the outbreak one, but countries should be prepared for a possible coronavirus pandemic. Currently, officials are looking for sustained outbreaks on different continents to check if the virus has reached pandemic levels. Some scientists think we are already there due to the surge in cases in South Korea and the deaths in Iran and Italy over the past few days. The term pandemic is relative, mainly because the factors that make a disease a pandemic are ambiguous. In 2009, the World Health Organization was also criticized when it declared swine flu a pandemic. Officials now say that the organization will not be hasty to formally declare a pandemic for the new coronavirus. However, the developments over the last few weeks mean that the world must take necessary steps and fast to limit the health, social and economic harms of the COVID-19 from developing into a pandemic.